Bouquet. We're both part of Louisiana Families for Vaccines, and as mentioned, my background is in microbiology and global health policy. I want to start by saying that when I became a mom, I was worried about vaccine hesitancy, but I also knew that nearly everyone around us was vaccinated, and I felt extremely lucky not to have to worry about my babies being exposed to diseases like measles, but unfortunately that's changing for families today. In addition to the danger of misinformation that causes individuals to delay or decline vaccines altogether, state and federal leaders are proposing policies that could result in the reversal of decades of public health protections. And so we're here to talk to you today about that threat and what we think that the people of Louisiana can do about it. So I want to start by acknowledging the amazing success that vaccines have been in reducing the burden of disease in the United States. The blue bars in this chart show the peak number of diseases in the United States during the 20th century before vaccines became widely available. And the red bars, which are very small, show the number of cases in 2022. We sometimes hear from folks who credit clean water and sanitation to this reduction in diseases that is seen here. And there's no doubt that these things, as well as better access to nutritious food, play a critical role in public health. But public health is not a zero-sum game. The charts on the next slide show how important vaccines have been to the elimination of diseases in the United States. So on this chart, you can see the number of cases of polio in the United States by year. And after the introduction of the polio vaccine, you see the cases drop drastically. And by 1979, we eliminated polio from the United States. In the next chart, this shows measles, a great example and a timely one with the ongoing outbreak that's happening now in our neighboring state of Texas. So measles is the most contagious infectious disease that we know. And you can see that before the vaccine, the number of measles cases was extremely high every year in the United States. However, cases dropped drastically again after the introduction of the measles vaccine, and by the year 2000, we had eliminated measles in the United States. But let's zoom in a little bit on these last few years a little bit more closely. So if you look at the next chart, you can see that in 2014 and 2019, we had peaks of disease. And during these years, we actually did experience transmission within the United States. And this happened among communities with very low vaccination rates. This was a warning sign that measles can return if our vaccination rates get too low. The states that were the epicenters of these outbreaks responded by changing their policies to encourage more families to vaccinate. Namely, they removed non-medical exemptions to vaccines requirements for school. But other states simultaneously experienced a backlash to these policy changes and saw proposals, for example, to expand exemptions. But in Louisiana, this wasn't the case. So let's look at the next slide that shows measles vaccination trends in Louisiana. So Louisiana already had and still has very lax exemption laws, and yet Louisiana families overwhelmingly choose to vaccinate. In fact, for many years, vaccination rates in Louisiana were above those of the rest of the nation and well above the 95% threshold that is needed to prevent an outbreak of measles. But unfortunately, the pandemic changed that. And so now you see with this drastic decline in vaccination rates, Louisiana is both below that 95% threshold needed for protection and below the national average. And so if you go to the next slide, unfortunately, we are starting to feel the impacts of vaccine hesitancy in our state. And I'm going to turn it over now to Dr. Bouquet to talk to you more about that.
Hi, I'm Dr. Bouquet. I'm a pediatrician here in Baton Rouge, and vaccine hesitancy has affected my practice daily. About 10 years ago when I started training, we knew that the majority of patients would get vaccinated, but we always had a few that were hesitant. And we would talk with the families about why vaccines were safe and important for their child. This talk would maybe only happen once a week, maybe once a month. Now I'm having this talk every day. Every day I'm talking with mothers who are scared with what they're seeing on social media about vaccines. It's all misinformation now. But when it's so loud, when the noise of the misinformation overwhelms the physicians' voices, it can be very scary for the mother. So I'm here to promote that we need public policies that say that vaccines are safe and effective. We need that backing of our government and our politicians that say that physicians are behind vaccines and promote vaccines. Just this past few months, we've seen the measles outbreak in Texas. Today I had to order measles swabs for my clinic because we think very soon we may see measles here. It's very scary. I've only learned about measles in textbooks. I've never seen a case of measles. Polio, chickenpox. I personally had chickenpox, but these are things that I've never personally treated. We've only learned about in textbooks because of vaccines, because vaccines work. We are starting to see pertussis in Louisiana. We've had 2 infants die of pertussis. Unfortunately, these infants didn't have the opportunity to be vaccinated. They depended on their mothers to be vaccinated while they were pregnant. And often this vaccine is not able to be given until you're 2 months of age. So the way that we protect babies from pertussis is either the mother's immunity spreads to the baby during pregnancy, or we have a herd immunity. The people that are around that baby are protected and therefore will protect the baby. So these diseases, although had been gone away and we were able to protect against, are now coming back. And it's a very, very scary time. When it comes to hesitancy, my focus is to discuss with the families their concerns. There's always a choice, but I want them to really trust the physicians and the scientists who've made these vaccines, have studied them rigorously, and know that they're safe and effective.
And so now that we're here, we also want to talk a bit about how we got here. Anti-vaccine activists, and I'm not talking about the families who are asking questions and who may even delay or decline vaccines. I'm talking about those who directly profit from this deliberate spread of false information. And they've always been around since the very first vaccine was invented over 200 years ago. But for the most part, they have remained a fringe movement. However, the pandemic changed all that. Activists who've been organizing for years were able to take advantage of a vulnerable situation and gain quite a platform. And the result is a well-funded, well-organized movement that is making political change in this country. In 2023, the largest anti-vaccine organizations in the country brought in over $63 million, including Children's Health Defense, which RFK Jr. ran for many years before his presidential run, and the Informed Consent Action Network, which is run by Del Bigtree, who was also the communications director for RFK Jr.'s presidential campaign. In addition, you can see that there are state-level anti-vaccine organizations in every state in the country. There's no pro-vaccine movement that can match this. Not yet, anyway. And they've been working very hard and for many years to influence state legislators. And this has been the trend in state-level vaccine policy in terms of the numbers of vaccine-related bills that we've seen introduced at the state level across the country. You can see that in 2022, we saw a huge jump in the number of bills, up to 1,500. And I will tell you that in the vaccine world, we were concerned in 2019, which looks measly now. And that number did start to decrease, but in 2025, Safe Communities Coalition is monitoring more bills in the first 8 weeks of legislative sessions around the country than last year. And some states like Louisiana aren't even in session yet, so we do expect that this number is going to rise. And speaking of Louisiana, let's look at what vaccine legislation has looked like in our state over the last few years and talk a little bit about what we are seeing now. So if you go to the next slide, please. Thank you. This graph shows the number of vaccine bills that have been introduced in Louisiana since 2022, when Louisiana Families for Vaccines was established. And in that year, we followed 40 bills, 39 of which we considered anti-vaccine. And we worked with the community, with state-based organizations to raise awareness around what it would mean, what the impacts would be if these bills were passed. And ultimately, 38 of those bills were stopped in the legislature, and one was vetoed by the governor. And over the last 3 years, anti-vaccine topics in Louisiana legislation have included things like banning vaccine requirements, limiting access to vaccines, and even bills that connect vaccines with autism, which has been largely debunked by decades of scientific studies. Thankfully, the most dangerous of these bills have failed to pass in our state, but we continue to see similar bills introduced year after year. And high-profile anti-vaccine activists have been invited to speak with our state lawmakers, including RFK Jr., who was here in 2021, when he told Louisiana legislators false information that the COVID vaccine was more dangerous for children than COVID. And last September, Aaron Siri spoke with lawmakers. Aaron Siri is the lawyer who was in the news recently for petitioning the FDA to revoke approval of the polio vaccine, among others. During this same legislative meeting with Aaron Siri, our own state Surgeon General repeated falsehoods that RFK Jr. told legislators in 2021 about the COVID vaccine. And the Deputy Surgeon General suggested that there was a link between vaccines and autism. Again, a link that we know has been thoroughly disproven. Not long after the Surgeon General's office released a flu vaccine exemption letter for healthcare workers that contained false information about the safety and efficacy of the flu vaccine. And by December of 2024, a report came out revealing an unofficial policy that LDH was no longer allowed to promote flu, COVID, or Mpox vaccines. And we had noticed that the Department of Health stopped sharing information about vaccines since August. So we weren't completely surprised in December. They even shared a post about the flu in December, and this is when Louisiana was experiencing the highest flu rates in the nation. And they listed ways to avoid catching the flu, but conspicuously, as many commenters on the post noted, did not mention the flu vaccine. The day RFK Jr. was confirmed as Secretary of Health and Human Services, leaders at the Louisiana Department of Health released their official policy that the state would no longer promote vaccines or offer mass vaccine clinics. And it's our understanding that state health units will still offer vaccines for those who go in and request them, but the new policy claims to want to prioritize informed consent and the patient-doctor relationship, both extremely important things that we all think need to happen, but this represents a false dichotomy. Sharing accurate information about vaccines and making them more accessible to the people who want them is not in conflict with informed consent or a patient-doctor relationship, but only adds to the health of our community. So I'm going to let Dr. Bouquet again say more about that.
As a physician, it's very important that our public health department and our politicians back us up. During flu season, we need them to promote the flu vaccine. That's how we make sure people are safe and healthy. We need them to discuss what the update vaccines need to be given for the children. We need them to continue to back these vaccines. When they come out with policies that state they're no longer going to promote vaccines, but it's up to the family to come and talk with us about it, those don't go hand in hand. They're going against each other. We need them to continue to go be out in the community and provide access to vaccines. Not everybody is able to go to their physician and get a vaccine easily. There might be a wait. Some don't have transportation. They require these outreach vaccine clinics to get their vaccinations, their flu vaccine. So for the public health department to come out with this policy, it was just very discerning. And I fear what our rates of flu and COVID will be in the future. We need our politicians and our public health leaders to continue to follow the science, to continue to make recommendations for the most evidence-based medicine.
And so it's frustrating, to say the least, to feel that our leaders of public health in our state are in some very important ways at odds with public health and in helping to improve the health of our communities. And so if you go to the next slide, as we wrap up, we wanted to share what we, the people of Louisiana, can do moving forward. And we know that the majority of Louisianans, as we discussed earlier, choose to vaccinate. And even for those who don't, many of them are simply searching for accurate information to help them make the right decisions for their families. And they deserve access to accurate information. And at Louisiana Families for Vaccines, we are dedicated to advocating for evidence-based vaccine policies that promote public health and protect access to life-saving vaccines. And so for anyone who is interested in doing the same thing, we welcome you to join us. In addition, I wanted to let you know that we're part of a growing movement of vaccine advocates across the U.S., all working in their own states to strengthen the health of their communities by promoting evidence-based vaccine policies. And if you go to the next slide, just as we wrap up, I want to say that now is the time for you to get involved to protect access to vaccines, to ensure that we all have access to accurate information on the risks and benefits of vaccines as well as the diseases that they prevent, and to make sure that our policies are evidence-based. And so for those who want to take the first step, we do have an open letter to Louisiana Department of Health on our website that you can add your name to. And there you can also sign up to be more involved in our work. No experience of any kind needed. If you want to make a difference and you want to help our state avoid outbreaks of disease that are completely preventable, that's enough. Whether you have 5 minutes, 5 hours, or 5 months of time, there's something that you can do to help. And so I really want to thank you all for your time and your attention. I mean, if you wanted to say anything else, Dr. Bouquet?
Yes, I want to thank y'all so much for having us. I want you to know that all the physicians out there are fighting as well. Many organizations within Louisiana are writing letters to our public health department, to our politicians, at the federal level as well. So we're not going to give up this fight. We want our kids and our patients and our families to be healthy. We want a healthy Louisiana, a healthy America. Thank you.
Yes.
Here's my question, one and only. A few years ago, when, COVID came, it was less than a few weeks actually, probably 11 to 12 days after we found that Mardi Gras was a spread event, and we didn't have a vaccine for it at the time. Mm-hmm. Is there anything right now that y'all are tracking that might indicate whether, Super Bowl and Mardi Gras was spreader events, or particularly, could be spreader events for some of these diseases that we do have vaccine, for right now?
Yeah, so the question is, similar to a few years ago, before there was a vaccine for COVID, and we found out that, you know, Mardi Gras was one of these super spreader events in Louisiana. And his question is there any evidence now that Mardi Gras or the Super Bowl may have been a super spreader event for some of these diseases that we're seeing reduced vaccination rates for? And I think that is still to come, that we don't know yet. I don't know, Dr. Bouquet, if you want to add.
Yeah, I mean, you're exactly right. It's important for physicians to be informed. And so we rely on the state health department, our larger medical organizations to keep us up to date on what's out there. When certain organizations are silenced, like CDC, NIH, our own public health department, when I try to search pertussis outbreak right now, it's very difficult for me to find numbers on how many kids have been diagnosed with pertussis in our state. There isn't transparency there, and that's really important for us to have that transparency so that we can best let the community know what we need them to do, that maybe, hey, it's not a good idea to go to this parade. And when we don't have all the data, all the information, it can be very difficult to let the community know what we need them to do. The most important thing we can do, though, is vaccinate. We know right now that if you vaccinate, you're protected, and you can go out and to do things in the community, right? And so prevention is always key. That's number one. And that's what we're really talking about today. But transparency of what is at risk is huge.
I may have missed this, but what is your budget versus the anti-vaccine group?
Oh, we got low fuel, right?
Yeah.
A lot of this is just blood, sweat, and tears. I'll let you give the numbers.
Yeah, so they were at $63 million. Now, of course, that was over several organizations, and I can only speak for ours, but you know, nationwide, we're less than $1 million organization. So, you know, but everyone in this work is dedicated and passionate and, you know, in it to protect our kids and to protect our communities. Yeah.
I like that you brought up money, though, because this is a thing that is being misinformed as well, is that physicians are making money off of vaccines. Preventative health is the least expensive thing that we can do in medicine, is to prevent an illness. Pediatricians really make no profit off of vaccines. And so when people are, you know, using that argument of, well, there's a reason that the physician or the pediatrician wants you to get this vaccine is because it makes them money. No, I just want to protect and save babies. And so, you know, it's a struggle to get that out there, that knowledge, that preventative health care saves money, saves healthcare dollars.
And I'll just make one last point, that we get funding from a variety of sources, including, you know, foundations and grants, also individual donors. So if anybody's interested, lafamiliesforvaccines.org/donate, and we would really appreciate your support. If you know, can't volunteer and get involved directly, that's another way that you can support the work that we do.
Yeah, in New Orleans, I think it's Orleans Parish has decided that they're going to do a promotional campaign, their health units and whatnot down with their people, and pay for it themselves.
Yes.
Are there other groups that are organizing like that?
Basically,
that
the
New
New Orleans Health Department.
Unit and get the vaccine, because people don't
know.
They don't have doctors either, so you can go to the health units. I'm wondering if there's another educational campaign, other parishes are doing that, picking up the mantle when the state isn't.
So the question was that the New Orleans Health Department is doing what's in their capacity to make sure that their community has access to vaccines. And are there other organizations around the state doing the same thing in other parts of the state that New Orleans Health Department just can't reach? And that is something that we are still looking to find out, because it does feel like with the state not doing this critical function in public health, that it is going to be left to other organizations to kind of pick up the ball and try to get that protection to their communities.
I would say most major hospitals are doing campaigns, commercials, advertisements, stating how important it is, to get your flu shot. But it's important to also have them be backed up by the public health department.
Yes, Leon.
Dr. Herricks, you and I spoke about RFK Jr.'s nomination about a month ago. Your organization got 100 pediatricians or so to sign on to a letter urging Senator Cassidy to vote no. He ended up voting yes. We talked about that as well. I'm curious, now that we had the measles death in Texas, he came out and said, go get this vaccine, go get the measles vaccine. Was that a surprise to you? And what do you think that says about national vaccine policy going forward?
So, even though Senator Cassidy voted yes, his comments publicly have always been very pro-vaccine. So I was not surprised, but, now I think it was a couple of days ago that CDC announced that they are going to be doing a new study into whether or not vaccines cause autism, which is something that they talked about during RFK's confirmation hearing. And Senator Cassidy, said, "Are you going to do this?" RFK said, "Well, if you show me the data, I'll believe it." And he pulled up a study of 1.2 million children, vaccinated and unvaccinated, that showed no difference in the levels of autism. So, clearly this is messaging that is going to cause more parents to question and be hesitant. And hopefully they have that physician relationship. Mikki talked about, some families unfortunately don't have that. But also, if this study happens, it's important to think about the things that aren't happening. Because if you go to the Autism Science Foundation's website, you will see the entire list of studies that have been done looking at vaccines and autism, and it is thorough, and there's no link. And so why are we spending more money on something that has been clearly debunked when we could put that money towards helping families with autism and towards finding a real answer for those families, because they really deserve it, and I feel like it's getting taken away. That was something that Senator Cassidy, discussed with RFK Jr., and I hope that he starts questioning him on why they're doing this now. When the studies are out there, he showed them the studies are publicly available, and, what are we taking away from those families with autism?
I would just speak to the studies. The studies are across several countries, over 20 plus studies with lots of children, peer-reviewed, scientifically, the strongest evidence that we have out there. And so it's very frustrating when you hear someone say that, we need more studies. We're, like you said, we're wasting time and resources on when we could be looking into other causes of autism. And that does a disservice to these families.
Would you say, if I may follow up, would you say that is needed from your point of view? I mean, if you can have, can we live in a world where we can also say, we're pro-vaccines, go get your children vaccinated, but also, hey, let's look at these rising autism rates that have been going on for the past 30, 40 years. Are we able to have both of those conversations at the same time?
Yeah, pediatricians want to know too. We want to be able to figure out what's causing the increased rates of autism. We see children with autism in our clinic multiple times a day, and we want to give them the best fighting chance to have a normal life. And I can be pro-vaccine and also be pro-autism and be a resource for the families to try to figure out what could be causing this or ways to improve their health. You can have both. And I want them to continue to seek knowledge to figure out what's causing autism.
And I'll just, add to that to give a little credit to the scientific community that they have been doing both for decades, because, the first study that came out that was eventually debunked and retracted that showed a link between vaccines and autism, and I'll say it was I think it was 12 kids or less. It was something that the scientific community took very seriously, in addition to parents. And millions of dollars went into research for decades to see if there was any plausible link, and has turned up nothing. And so I think we owe it to those families to move forward, to really find them some answers that they deserve. Thank you. Yes, ma'am.
These authorities who are anti-vaxxers, do they themselves
Get vaccinated?
get vaccinated and have their children and grandchildren vaccinated?
Yeah, a lot of them.
So they're hypocrites.
Yeah. The question was, is many of the people who are more in the anti-vaccine movement, do many of them get vaccinated, or are their children vaccinated? And that's 100% the case, yeah. What's frustrating is a lot of times the policies that they propose or that they are promoting limit access to care to people who are vulnerable in our community. It doesn't limit for them to get the vaccines, but it's going to limit it to our elderly, our adolescents, our foster care children. So that's really frustrating. You're right, it's a hypocrite.
Yes.
You may have covered this, but I got distracted by some of this work I'm doing here. But is there anything pre-filed in the session coming up to try to overcome the proclamation or the edict from the state health department?
So bills just started getting pre-filed last week, and so far we have not seen any vaccine-related bills. The question was if we have seen any proposals coming pre-filed from the legislature to kind of overturn some of the policies that the Louisiana Department of Health has recently put into place, but not yet. Did you have a question, sir?
Yeah. About 25% of Louisianians are college graduates. I assume both of you are. So that means 75% are not.
Mm-hmm.
And I think of driving in the early mist before sunrise, and I see a house on the side of the road with a light on, and they're trying to get the kids ready and make decisions and pay bills and such. And all of us, if I think of it as automotive, I think of can be a terrible accident. But in my 20 years as a Boy Scout leader, raising my kids and putting them in public school and then later on in Catholic school, I can never think of a single time that a parent said they weren't going to put their child in a car with all the modern safety features. And yet we all know something could happen. With all the cars on the road at Interstate 10, all at Interstate 20, all across the state, all day to day, the risk of an accident, which is what I think people are scared of, the vaccines, is probably much higher for an automobile accident, and yet we put our kids in the car and we go about our life.
Mm-hmm.
My thinking is that the person not putting the kid in the car is not going to say, oh, I don't want my child on the car. It's leaving the child on the hood. And that's a big difference because Louisianians understand, I think that's what you're trying to talk to Louisianians. It's not that something with a vaccine can't, in the rarest of rarest experience, have a bad thing, which you're now scared of. But you put your kid in the car because you want them safe.
Mm-hmm.
You don't want them on the hood. I see no one on the hood, and I see laws that prohibit it. But we had laws that said you must vaccine. Is that what you're trying to do, is to tell people, yes, there's risk, but it's incidental? And you should vaccine for that reason.
Yeah. So to summarize, I think what your question is, and let me know if I got it right, is if we compare the disease as a car wreck waiting to happen, and the vaccine is a seatbelt, right? And so everything has risk. If you decide to put your kid in a car without a seatbelt, you know, the risk of them getting in an accident is probably pretty low, but if you do, the risk of them being seriously injured is high. And with a seatbelt, your risk of getting seriously injured, you know, you might still get in that accident. It's not going to 100% prevent you from getting in an accident, but it could prevent you from getting seriously injured. However, there is a minuscule risk associated with wearing a seatbelt. And there are incidences in which wearing a seatbelt has been associated with harm. And it is the same with a vaccine. Vaccines are exceedingly safe, and they are like that seatbelt in the car. There are rare instances in which there may be an adverse reaction, but they are so rare compared to the damage that can be done if you encounter one of these diseases and you don't have your vaccine.
Mm-hmm. Yeah, I mean, again, I'm a pediatrician, so everything's about prevention. We wear a helmet when we ride a bike. We wear a seatbelt when we're in a car. You know, these things might not happen, but we do it to protect the child. I think it's very easy to forget about these diseases because we haven't seen them, and to think that the risk isn't there, and to not vaccinate. But it's important to vaccinate because there is that risk. And the overwhelming benefit from the vaccine is so much superior to the minuscule risk of getting that vaccine. And the more we see these illnesses come back, the risk that those illnesses will cause severe morbidity, mortality is a lot higher than the risk of getting a vaccine to prevent that illness. Does that make sense?
I wanted to ask if you all would explain herd immunity, which is a term that I see in the media a lot of times, and I'm not sure that the public understands that.
Yeah, so you don't just vaccinate for your child or for yourself. When you vaccinate, you help your community. Every disease is different. For measles, 95% of people need to be vaccinated to prevent an outbreak. That's herd immunity. So we can protect the 5% in that community that maybe can't get vaccinated. Maybe they are on chemotherapy. Maybe they're a baby under 12 months. Herd immunity allows those people to be protected. But the more that vaccine rates drop, the less that we have herd immunity. And it not only puts people who are unvaccinated at risk, but it also puts the people who are vaccinated at risk, because then we start to have outbreaks. The people who are vaccinated are going to be better protected. They're not going to have as severe of a course, if not at all, but it's the people who are unvaccinated who are the most at risk.
Any other questions? Oh, sorry.
Are there physicians that advise their patients to get vaccinated and these patients refuse, and then the physician says, I don't want you as a patient anymore because you're putting my other patients at risk?
Yeah, so a lot of people...
Repeat the question.
Okay, so the question was, if a patient decides not to be vaccinated, could they potentially be fired by their physician? And ethically, that's true. You have a period of time where you have to continue to see that patient, but if you feel like you are not on the same page as your patient, you can potentially fire that patient. What I think is interesting is I don't believe in that. I want to see all children out there, whether their parent wants them to be vaccinated or not, because every opportunity that I spend with that parent, I'm hoping that I can get them to agree to be vaccinated. We do get them to sign a form that says that they refused the vaccine against our medical advice, and that's just for a liability. But I think it's really important. Again, that would make me a hypocrite, right, if I'm not taking care of all kids. But it is the right of the provider to say that they don't want to provide services to you anymore. I do think it's important to realize that ethically they're protected, but morally is that the right thing? Because I do believe in informed consent, and I think each opportunity that I spend with a family and I can go over what their concerns are, I have the potential to get them to see my side of things.
Do you ever have physicians that do it to protect other patients who are vulnerable?
Yeah, so that's a good point. Another reason why some physicians will decide not to see those patients is because they feel like they're advocating for the kids that can't get vaccinated. So if you have infants coming in and out of your office that can't be vaccinated yet because they're too young, if you have unvaccinated children also coming to that same waiting room, it puts those babies at risk. And that is why many of them will argue that they will not see children or families that choose to be unvaccinated. You could always have 2 waiting rooms. You could pull back, the infants as soon as they come in to protect them. So there's ways around that, but that is an argument. My thoughts, again, there are more people in our society are becoming unvaccinated. And so they're a risk in the community, not just in my office, but in the community. So again, I want to just continue to promote the importance of vaccines and do outreach and hopefully get people to see, our side of things.
Any other questions?
I have a backup question. When you represent organizations such as universities, medical schools, large studies that have done not one time but years and years, then do people like you then go to legislators and say, look, here's the reward, risk, just like you said, someone could get hurt by a seatbelt. But then the legislators, don't they take that into a case? And then, don't we have laws that mandate that children be seatbelted in?
So, that's tough. No, I'll let you know.
Yes, so of course, we do try to provide evidence, yes. But I think the other thing that legislators take into account too is when they're hearing from their constituents. And for a very long time, they've only been hearing, I think, from one set of constituents. And, the majority of families who vaccinate their kids and they go about their everyday life, for them, this hasn't seemed like a big issue. If they're not studying it or in the trenches, like Dr. Bouquet, they don't see the rise of vaccine hesitancy maybe as a concern. So hopefully now that we're seeing access to vaccines put at risk, in addition to having outbreaks in nearby states, hopefully people begin to see the importance of this issue and that they do need to speak out. And that is something that, that is why we're here, is to help people get their voices heard. Yes, it's important for legislators to have all of the data, but it is important for them to hear from the people in their communities that they're serving, because that's why they're there. And they want to hear from more people. So I would encourage everyone to get involved.
I do find it interesting that you bring up the seatbelts, and there was actually a lot of pushback against that when it first came out, when it was becoming, federally mandated for children to be restrained. I'm hesitant to say that we should mandate vaccines that rigorously. I think it's important to continue to have the choice to have informed consent, because we aren't a patriarchy. We aren't forcing you to do something, because we know best. We want you to know the risks and benefits and for you to choose what we think is best. And so I would go against a full mandate. We may have to start looking at schools and have stricter vaccine requirements within the schools, because we might have large outbreaks at schools. But as far as like a full-on mandate for all kids to be vaccinated, that's not where our stance is. We just want to continue to have strong vaccine policies that increase access to care, that aren't vaccine misinformation, like continuing to do research with vaccines and autism or vaccines and SIDS when those have continued to be debunked, and to promote vaccines, promote the seasonal flu vaccine, promote childhood vaccines, so that our public knows that they're safe and effective.
Thank you both so much for coming.
I have a PhD, yes, sir. Is that good?
Picture all the people. That's missing me in my, what do you call it, Grim Reaper suit. You're laughing, I'm not.